Hi everyone, and welcome along to this webinar from Tiny Tickers. My name is John. I work at Tiny Tickers and I'm your host for this webinar. I'm delighted to say we're going to be joined by two experts here as well to talk about this topic of preparing for your child's cardiac surgery. So we've got Helen Walker, who is the team lead for the cardiac nurse specialist at Alder Hey Hospital in Liverpool, and Dr. Rachel Avison, who is a principal clinical psychologist in the paediatric psychology service at the Leeds General Infirmary. So you're most welcome, whether you're watching live here today on Wednesday lunchtime, whether you're watching the video that we put on our website later. I hope you find this a really useful and interesting session. Of course, this is one of a series of webinars that we've provided here at Tiny Tickers, all of which are available for free on our website, so you can watch any of the ones that you'd like to that are relevant to you. So others in the series that we've done already include a webinar on supporting your mental health and well-being as a parent, for preparing for the birth of your child when you know they've got a cardiac condition, for taking your little one on holiday and traveling when you've got a baby with a heart defect, for them then starting school and nursery and different topics like that. We did one for around siblings as well, preparing siblings, their little brother or sister is going to have a heart condition. So if any of those topics are relevant to you, you'll be able to find them all on our website. And our webinars go alongside all of our other support work as well. So as some of you will be aware, we've got online peer support groups, we've got Facebook groups, we've got all of the information on our website, on our YouTube channel. We've got parent support booklets and packs that we send out, which I'll talk a little bit about later as well. So a whole menu of support. So hopefully this is just one of the ways that we're able to support you through this tough time taking your child in for surgery. A couple of announcements and sort of thank yous before we get started. So first of all, I need to thank Global Make Some Noise, who have funded a lot of that support work that I've talked about over the last couple of years, including this webinar series. And I'm also conscious that a number of you, when you signed up for the webinar, made a small personal donation as well. So I just want to say thank you so much for your generosity. If you're able to do that, it's very gratefully received. Vicky from the team is going to be in the chat throughout the webinar as well. So please do open up the chat box. Feel free to say hello to her as well. Maybe tell us who you are, a little bit about your circumstances, where you're joining us from today. And you'll also be able to pop any questions into the chat box as well. So on Zoom, if you're not familiar, there's a chat function and there's also a Q&A box. And if you've got any questions as we go through the webinar, pop them in there. And we'll come to as many of them as we can at the end of the session. Obviously, just bear in mind that we're not able to give specific medical advice or go in depth on any particular case. But if you've got a general question, then feel free to do that. So the format of the webinar is that I'll hand over to Helen first. She's going to talk about this topic from the nursing perspective. And then we'll hand over to Rachel to talk about it from the psychological perspective. And then if there are any questions, we'll have a chat at the end and answer as many of those as possible. We're thinking it's probably going to run for about 40 minutes, something like that, 45 minutes, so not too long. We are recording it, so if you're not able to stay for the whole thing, then you can come back and watch it when we release the recording as soon as possible afterwards. The one caveat I always say on these webinars is none of us on the call are IT experts, so something might go wrong technically. If anything does, if we do have any technical problems, please do bear with us and we'll try our best to sort them out as quickly as possible. If you lose a connection yourself and drop out of the call, you should just be able to rejoin using the same link that you used to get here in the first place. Okay. Sometimes we also, on these webinars, if you've been to any others, you'll know that we have a little staff video from Tiny Tickers as well, where those of us in the team who have experience of the particular topic will do a little chat as well, so you can get sort of some peer perspective on things. We've decided this is such a big topic, isn't it, preparing for surgery, that we didn't want to cut that down to just a really short video. So we're going to do kind of an extended DVD bonus episode, as it were. So we're going to record the chat between the staff team and we'll send you a link to that. And that's going to be a separate video that you'll be able to watch in your own time. And hopefully you'll find that really useful as well. And that will come along with a handout of some notes from today's session as well. So don't feel as though you have to scribble down everything that everyone's saying. Okay. And the last thing I wanted to mention just before we get started and I hand over to Helen is that obviously this is a really difficult topic, isn't it? It's one of the most stressful things I think you can go through as a parent taking a child in for surgery. So I just wanted to sort of give that trigger warning, as it were. This is obviously going to be some themes that are quite difficult that we're talking about today. So please do be kind to yourself as we go through this webinar. If you need to take a bit of time out, as I said, it's all going to be recorded, so you'll be able to come back to it and watch the video. If you've got a busy day, do just try to take a few minutes after the webinar just to have a cup of tea or a quick walk and just settle yourself before you plough back into your work life or whatever it is you're doing today. So with all of that in mind, I will now hand over to Helen, who's going to talk about this topic from the nursing perspective. So thanks very much, Helen.
Thanks, John. Good afternoon, everybody. I'm just going to try and share my screen.
Whilst you're just doing that, Helen, actually, I'm just going to say, so obviously Helen has very kindly joined us from the Alder Hey Hospital, but I think it's very fair to say, isn't it, Helen, that the themes you're going to be talking about today are going to be just as relevant to whichever surgical centre you're getting
Yeah.
from.
Yeah, there will be slight differences, and I've commented on them through the presentation. But yeah, it will be sort of generally the same no matter where you are.
Brilliant. Thank you so much.
So thanks for having me today. As John said, my name is Helen. I'm one of the cardiac and air specialists at Alder Hey in Liverpool. And I'll try and be as neutral as possible, but working in Alder Hey for 25 years. Forgive me if I do refer slightly to Alder Hey. So the purpose of today is to help any parents and carers understand what to expect before, during, and after your child's cardiac surgery, and hopefully to make your experience as safe, smooth, and supportive as possible for you and your family and your child as well. So just to clarify before we move on, there is we're talking here today about cardiac surgery. So there is other procedures that we do in hospital called cardiac catheters, which I think sometimes is quite confusing for families to understand the difference. So cardiac catheter procedure is a keyhole procedure, which is usually done via the groin. It's an admission as a day case or an overnight stay. And you may or may not be aware of this already, or your child may have been through something like this before. And then cardiac surgery is open heart surgery, which is via the front of the chest or via the side of the chest. But as I say, for today's purposes, we're just focusing on cardiac surgery. So what to bring into hospital for your child specifically first. The most important things are button up the front pajamas. So they're just really useful, really comfortable for the children, easy access to the chest. So if your child is age dependent, obviously. Easy access to the chest. If they're asleep in the bed, then the button up the front pajamas can just be opened without disturbing them too much. And there is a charity called the Pajama Fairies who provide you with them, so you can get in touch with them if you would like to do that as well. Over the head clothing is quite difficult and cumbersome. Children won't usually want to lift their arms above their head very easily, very frequently. So button up the front, anything, baby grows, pajamas, whatever is easier really, and dependent on the age of the child as well. So favorite toys, blankets, or comfort item, obviously anything to keep them happy, a little taste of home, things like that. So a blanket, or a toy, a lot of trusts will ask you to wash them prior to coming into hospital as well, just so they're free from any dust and things like that that can collect. Books are always really useful, and as I say, anything for distraction really, colouring books, reading books, tablets, things like that. And toiletries, nappies if required, slippers, dressing gown, things like that. We will get the children age dependent again up and walking. So slippers are quite useful if they're of walking age. We do have play therapists attached to the ward. as well, who can provide like crafts and stuff like that for children just to keep them busy and occupied. So for parents, what to bring as well, comfortable clothes, tracksuit bottoms, things like that, comfortable shoes, um, snacks and drinks, phone chargers, really important. Again, books, something to keep you occupied, tablets. Some parents work while they're in hospital as well, so you can bring your laptop if you need to as well. And they can usually just get them tested by the hospital team who pat test plugs and stuff like that. Personal toiletries and any medications that you're on. Don't forget to think of yourself as well as your children when you come into hospital. And any important documents that you may need and contact numbers as well. Um, just a little bit of a side note. So just note where the local supermarket is nearest to the hospital, because hospitals can be quite expensive to buy food, breakfast, lunch, and dinner each day for yourselves. So if you note where your local supermarket is, then you can buy things from there and make them or just buy things to eat from your supermarket as well. So preparing your child emotionally can be quite difficult. So this can be really quite difficult, and we often have parents come to us and say, "I haven't mentioned anything to them, I haven't talked about it, don't know what to say." Um, it's really hard. It's really hard for parents themselves to take, on board what they're coming in for and what's going to happen, without having to put that on the child as well. So we get that it can be quite a difficult conversation, but there's lots of things out there to help you prepare emotionally for. Prepare your child emotionally for this. And children are all very different as well. So one child will just take it all in their strides, and another child will need, additional support and help. So basically what we say is the most important thing is talk honestly to your child. Don't lie to them. Don't jazz it up or anything like that. Just tell them what they need to know. And in Alder Hey, we tell the families the children need to know what they need to know. So they don't need to know the ins and outs of everything that's going to happen. And they don't need to know the risks and the complications, because that's our job as a parent. But they do need to know what is going to be on them, in them, aware of whilst they're awake. But obviously there's ways to do this. So we explain that the doctors will help to fix their heart. We use play therapy a lot to prepare children to familiarize themselves with what's going to happen during the hospital stay. And we use books and online resources. Um, Specifically, we use the British Heart Foundation's Sammy's Operation book, which used to be a hardback book, but now it's all online. And there's also videos that are now available. We've just produced with the Northwest Children's Heart Network. So they'll be on YouTube and they'll be on their website as well. So they're talking to your child about their heart condition. That's one of them. Talking to your child about surgery, and using play therapy to help your child prepare as well. Once we're aware of a child going to have surgery, we'll discuss with the family how they are, what their understanding is, and what they know about what's going to happen. And if we feel it's necessary, we will refer to our play therapist, who does outpatient visits for play therapy in preparation for surgery. And at that point, she uses toy medical kits to do role play, which significantly reduces their anxiety. Um, so we also do ward visits as well, and that really helps the children. They know where they're going, they see their environment, and they can familiarise themselves with their environment. To help prepare adults, parents, carers, we use our pre-assessment clinic, which is which is done once the patient is added to the waiting list. So as soon as we know that the child needs an operation, we bring them into Alder Hey to come and visit us. And it's an information given clinic really for the parents. We do a couple of um, practical bits and bobs, like swabs and things like that. But often it's more of an information given clinic to help prepare the parents and the child if they're of an appropriate age. So at that clinic, we discuss the child's condition, we discuss their heart condition, and we go through that if they're not understanding of what's wrong with them. Then we talk about their operation and what the surgeon's going to do during that operation. And we discuss the recovery, hospital stay, things like that. So we talk about risks and complications. It's an informed consent process. So the families take all the information home and have time to digest that information and come back to us with any questions that they have. So the hospital environment, children's cardiac wards are, no matter where you are, bright, friendly spaces, designed for families, and that'll be in every trust that you see. You'll see monitors and you'll see tubes and noisy machines, but these will all help the team monitor your child closely. Um, Parents are usually encouraged to stay with their child before and after surgery, and the majority of surgical centres do have family accommodation available nearby. Ronald McDonald House is the one that is at Alder Hey, and yeah, you usually have your accommodation from the day you come in till the day you go home, and the accommodation is a bit like a hotel. You don't pay for it. Some ask for a deposit, which you get returned to you when you go home. They have a laundry, they have a kitchen with individual cupboard space and individual fridge space for you to keep your own food, things like that. And they have bathrooms within the family rooms as well. Okay. So staff that you'll meet, this could be an endless list. There's many, many, many people who you'll meet at Alder Hey. If you've been in hospital before, had surgery before, just been outpatient before, just been a day admission before, then you might have met some of these people in the past. So we have cardiac surgeon who performs the operation. An anaesthetist is the person who looks after your child whilst they're asleep and monitors the condition and the wellness of your child whilst they're asleep. The cardiologist is the doctor that you see who looks after you day to day. Cardiac nurses on the ward and the intensive care unit. Physiotherapists will always be involved in the recovery side of surgery. Play specialists as well will come and try and help prepare your child, but also help with distraction through procedures. If they're having a procedure, they'll always help with distraction, and they'll always help with things to keep them busy and their mind off what's actually going on. Psychologists and family support are available as well. In Alder Hey, we can refer to psychology team prior to cardiac surgery if there's a specific need for that. Also, interpreters we use quite often, and obviously cardiac nurse specialists. So we run, as well as our pre-assessment clinic, which is our information given clinic, we also run a pre-op clinic, and this will be similar in most surgical centres. They'll run some sort of pre-op clinic. So at Alder Hey, we run the pre-assessment clinic, as we said, which is nurse-led, and then we will run a pre-admission clinic, which is the week before surgery, once we have a date for the operation. This is a multidisciplinary clinic with lots of practical things going on in that clinic. So the children will have an ECG and an echo. They'll have a chest X-ray. They'll see a dentist. They'll see a physiotherapist. They'll see an anaesthetist as well and discuss what their role is and have a chat with the patient and the family about their role in the operation. They'll see some of the surgical team as well during that day, and they'll have an examination from one of us and a history, and we'll just make sure that the patient is fit and well. We run these two clinics, as I say, for an informed consent reason, so that we can have the information given in one section, and then we have the um, practical things in another session, and it seems to work quite well for us. Obviously, we've also got children who are of an age where have got their own questions, have got their own wants and needs, as well as parents and carers as well. So we will talk to the child about you know. Answer their questions and talk to them about what they need to know. As I say, children of an age, who are understanding will need to know that, they're going to have some drains in after their operation. They're going to have some pacing wires in as well. And they're going to have a scar down the chest. So we need to talk to them about that, because if we don't talk to them about that, then their trust will be gone, their anxiety will be raised. But also they'll be really quite scared post-operatively, and then you won't get that interaction from them, unless they're trusting you. Um, so that's why we run that how we do. And then some patients come to us the day before operation. So we only bleed. We only do pre-op bloods on our patients the day before an operation. We used to do them in the pre-admission clinic the week before, but we did an audit, and a lot of patients were being moved down the list. So we changed that just to try and reduce the risk of rebleed in the children for any list changes. Okay. So fasting before an anaesthetic. This is, I think I'm right in saying, universal throughout the country. So it's different between under ones and over 1 year olds. So we say no solid food for 6 hours. Um, you can have formula milk up to 4 hours before the procedure, and breast milk up to 3 hours before the procedure. And then clear fluids. We can have up until they go to theatre. So it's called sip and send. So you can sip water until you're sent for theatre. Um, Over 1 year old, it's no food or milk 6 hours prior to surgery, but they can also have water up until they go to theatre. Um, it's really important for the stomach to be empty for a safe anaesthetic. And if any children are on thickened fluids, these actually do count as milk, so need to be treated as such as well. So common procedures that children will have are a cannula. So that's you might heard of it as a drip, which is a small tube in the hand or the arm, sometimes in the foot in little babies, for fluids and medications, pain relief, things like that, post-operatively. Blood tests, as I mentioned, will be performed before surgery, but also we will do bloods post-surgery to check on kidney function, infection markers, things like that as well. Um, Drains and wires. So I mentioned chest drains. So all children having cardiac surgery will have chest drains, usually in this area here, in the mediastinal area or the pleural area. And that's just to take away any excess fluid that's not required post-operatively. Fluid tends to collect. It's a natural response of the body to retain any fluid in and around the heart area, but we want that fluid to be taken away because we don't want any added pressure on the heart or the lungs. So we take away the chest drain. We take away the fluid via the chest drains, and they sit in little buckets on the floor. Once the fluid has reduced, then the surgeons take them out. It's just a procedure that's done on the ward. Children are generally given some sedation for that to happen, and the older children tend to tell us that it's not painful, it's just a bit of a funny feeling. Wires as well. So pacing wires are put in all children who have cardiac surgery. They're little blue wires, and we put them in just for preventative reasons only. Some children, depending on their operation, are more at risk of developing abnormal heart rhythm post-operatively. So the beat of your heart sometimes becomes irregular or abnormal. And we monitor that closely. If there's any problems with that post-operatively, sometimes we can just keep an eye on it and observe it. And once the swelling comes down in and around the heart, then the rhythm will settle back down to normal. Sometimes the rhythm doesn't settle back down, and we can use a medication to sort that out. And sometimes we need to use these pacing wires, which sit on just outside the chest. The other ends sit attached to the bottom of the heart, and we can plug them into what we call an external pacemaker. And we can use that to get the rhythm back to normal, hopefully. If they're not used and the rhythm is fine and there's no issues, then we take the pacing wires out. Again, it's something that's done on the ward. Nothing needs to go back to theatre for that. And again, it's a very quick procedure. The drains will require a little stitching. So the stitch is attached to the drain. Once the drain comes out, then the stitch is tied off. So they're the only stitches that need taken out of the child post-operatively. The stitches in the wound will dissolve. So talking about the wounds, so dressings, we keep them clean and protected at Alder Hey. We take our dressing off the chest and the sternotomy wound after 3 days, and as long as there's no problems with the wounds, then that stays off. If there's any issues, the surgical team will look at that. We might redress it, and that will just be observed. Okay. So, possible delays. This is something that we find really difficult, and I know we all struggle with delays and cancellations as a nursing team, no matter what trust you're at. We do try our very best not to move surgery dates once the family are aware of them. But sometimes this is out of our hands. Behind the scenes, as nurses, we do advocate for our patients, and we do try where possible for this not to happen. Where patients are moved, we will move them into the next available slot. If a patient has had their pre-op bloods, then we will try to move them to within a new date of the time frame that they don't need to be re-bled for their pre-op bloods. Sometimes this isn't possible, and we do know how difficult it is to organise life, work, other children, dogs. Just everything really. But unfortunately, urgent cases do need and will take priority. Babies being born, that need urgent surgery will always take priority over an elective case who's well and at home. Unfortunately, that's just how it has to be. But staff will keep you informed. You can always ring your nurse specialist team or the surgical coordinator to keep you updated. But bring comfort items and be prepared for some waiting. Sometimes you're moved, from first to second case, something like that. Within cardiac surgery, and I'm sure it's the same for other trusts within the country, there's lots and lots of changes to our lists. And that's just the nature of what happens. We do have sort of antenatal families who were aware of coming, and we do try and factor that into our list planning. If we know that babies are being born and will need cardiac surgery, or we know that babies have just come over to our cardiac ward and will need surgery within a certain time frame, we do factor that into our scheduling. But sometimes things are just taken out of our hands, unfortunately. So after surgery, your child will wake up on intensive care, the intensive care, pediatric intensive care unit, attached to monitors and wires, and sometimes they'll be on a ventilator, which is a breathing tube, which helps them breathe whilst they're asleep. Depending on what your child's had done, and how old your child is will depend how long they're on the intensive care, how long they're on the ventilator. But that is all age dependent, child dependent, and condition dependent, operation dependent as well. Nurses will monitor closely for pain, comfort, breathing, please, speak to the nurses if you think, something's not right. You're their parents, you know them best, you're with them all the time. We're just here for a snapshot. So please let us know if you think something's not quite right, or they're in pain or not happy for whatever reason. Um, Parents are welcome to stay with your child. Generally, the only time you're asked to leave the intensive care is if there's a procedure that's going on the unit that they ask parents to leave for, but usually they try and keep that time to a minimum as well. So on our intensive care, it's 24-hour visiting for parents, and there'll always be individual visiting restrictions for other members of the family as well, usually two to a bed, something like that. And then, but there's no, you can't sleep with your child on the intensive care. But as I say, we won't ever ask you to leave unless there's a procedure going on. Um, so if a lot of parents say, "Oh, I'm not going to leave them, after their operation, I'm going to stay with them," and that's absolutely fine. But once they're out of the theatre, the surgeons come to speak to you. Um, they've told you what's gone on, how it's gone, what their plan is for the next, 6 to 12 hours. You've seen your child, you spent some time with them, you spoke to the nurse at the bedside who's looking after them, and you feel comfortable. The nurse will always encourage you to go and get some rest in the parents' accommodation, because the next day, if the child's going to be awake, they're going to want you then. And often parents are nodding off at the bedside because they've sat and looked at the child all night, which is quite normal. So yeah, it's very flexible. And there's phones in the parents' accommodation that, if we did need you, then we can always give you a ring, or if you wake up in the middle of the night and just wonder what's going on, you can just ring the bedside nurse as well. Apologies if anyone can hear my dog barking in the background. I do apologize. Um, so gradually, your child will move back to the cardiac ward where they started before their operation to continue their recovery. They may or may not need a high dependency unit if they've got one at your hospital. So this is like a step down between the intensive care and the ward, which sometimes your child doesn't quite need intensive care anymore, but isn't quite ready for the ward. So it's a little bit of an um, in between bit there. So, pain and management is managed with IV medications intravenous into the drip that we were talking about before, and then usually weaned off onto oral pain relief, which is all monitored very closely. And as I say, we use various things like intravenous morphine. For older children, this is on a specific pump that's programmed with a button, and we train the children how to use the button if they'll be getting a steady stream of the pain relief. But if they feel, it's quite sore at the moment, then they can give themselves a little press and it'll give them a little boost. And we can do this as well prior to any procedures that they're going to have, like their wires out or their drains out, things like that. Obviously, this is managed by the anaesthetic team. They can't overdose. It's all pre-programmed and things like that. Um, Discomfort is expected, but pain isn't. And we say to the children that you shouldn't be in any pain. You will be in a bit of discomfort, and it will be awkward and a bit uncomfortable, but you shouldn't be in any pain. So please let us know if that's occurring, and we can always add something in to try and help that. Um, and play and physiotherapy are really important to help the children regain their confidence and their mobility. Patients will be encouraged to mobilise as much as possible to reduce any further complications. Babies mobilise themselves and bounce back very quickly. They don't know what's going on, and it's quite an inconvenience for them to be stuck in a cot, really. They really adapt to their situation really quickly and are aware of their limitations at a really young age. The problems are usually in the older children with regards to mobilizing. Teenagers specifically tend not to want to mobilize because they're worried or they're scared. Um, but it's the best thing that they can do. If they're advised to do it, then they really should do it. It's going to really help them um, get moving. It reduces back pain. So, um, often they tend to hold themselves and their shoulders quite high up by their ears, and they hold themselves quite stiff. And I've had it recently with a boy whose mum rang up and she said he's just not moving. He's not moving his neck, he's not moving his shoulders at home. But she said he's just worried, to move. So we were just talking about some gentle exercises that the physiotherapist told them about when they were in. And we talked about taking it gradually, but daily, doing a little bit more each day, but just gradually, not to push themselves. And just keep, putting the shoulders down, even sitting at a desk. I think we're really bad at that. We sit here and we hunch our shoulders up, but if we're just mindful, and I said to his mum, just tell him every now and then, every half an hour, to put his shoulders down. He'll get fed up of it, but it will really work. And some gentle exercises and moving. And a lot of the children say, I can't believe you're asking me to get out of bed, on day one or day two. But it's for their mobility. So it's helping their lungs to recover. But it's also to help their mobility, because if you keep yourself stiff, then you're going to get back pain, as I say, which is quite common, unfortunately. Um, so yeah, physiotherapy is seen as somebody who wants to come and get you out of bed when you don't want to, but they're really useful, actually. So length of stay, it totally depends on the child, but most children stay anything between 5 and 10 days, depending on the complexity of the operation. We could have 10 children, all having the same operation, but they will all be in different lengths of time. They're all individuals. They'll all react to, things differently. For instance, the anaesthetic and wounds and things like that. So how long their drains are in will be different. So it all depends on the child, really. But average length of stay is usually around 5 to 10 days. And then recovery at home can take up to several weeks. We usually say to our families approximately 6 weeks. So the sternum, if they go through the front of the chest for the open heart surgery, they go through the sternum, which is like an arm or a leg. The bone will take about 6 weeks to heal. So we say at least 6 weeks. Some children take longer. Some, are back to normal much quicker. Um, but things to look out for are like wound care. Make sure your wound is healing nicely. If it isn't, contact your team and they can get somebody to look at it. Gentle exercise we've talked about, and avoiding infection are key, especially in those early couple of weeks. So try and keep them away from any extended family who are poorly. We say back to school at approximately 4 weeks. This might be different in different trusts, but don't go back to school before your first outpatient review. And we say no PE for 6 weeks. And then when you do start going back to PE, don't expect yourself just to go back where you left off before your operation. You need to build your stamina up. Your body has been through quite a lot in the last few weeks. So you need to sort of retrain it and build your stamina back up, which can take several weeks as well. Um, so risks and complications will all be discussed in detail at some point prior to surgery with yourselves, parents, carers, and or the children, again, dependent on their age. Complications and risks tend to include infection, bleeding, irregular heartbeat, which we've talked about. Adverse reactions to anaesthetics are quite rare. Fluid around the heart and the lungs sometimes takes a little bit of time to clear. Sometimes it can reoccur, so we just need to monitor that really quite closely. And rarely there's need for further surgery, but in some cases, some really complex operations, we do need to go back in to theatre. But every effort is made to reduce these risks and get you home as soon as possible. As I say, we discuss these risks and complications in our pre-assessment appointment, which gives the families time to go home, have a think, understand, and come back to us again with questions, which then lead you on to sign and consent. Once you do understand what's going to happen and everything's been explained to you in detail, you've been given the opportunity to answer or ask any questions that you've got, or any questions that the child has got as well, because that's just as important as parents' questions. You'll be asked to give written consent for the operation. Um, as we said, take time to ask your questions and understand, but you'll also need to understand and consent for blood transfusions or specific techniques during the operation as well. Consent needs to be done by a parent who's got parental responsibility. Unmarried parents, dads need to be on the birth certificate for them to be able to sign consent. And at Alder Hey, we do ask parents to sign consent for blood transfusion as well. So going home before discharge, you'll go through any new medications that or any medications that your child is going home on. They'll explain what they are, what they do, how to give them, and how to get more of those medications. Some medications that we use in cardiac children cannot be prescribed by the GP. So just check with the nurses before you go home that you will be able to get them on repeat prescription for your GP. As some medications need to be prescribed by the specialist hospital. They'll check the wound is healing okay, give you contact numbers for any concerns if you've got any problems when you go home, and arrange a follow-up visit with your cardiologist to be seen in the outpatient department. We've discussed about resuming activities with school and nurseries, and just make sure the schools are informed of why you're off and how long you feel like you're going to be off. Usually you get a discharge summary to go home, which will detail what you've been in for, what's happened while you've been in, and what to expect going home, and discharge a device leaflet on what to look out for as well. Usually, you go home and you're seen within about 10 days, 2 weeks of going home. Your follow-up appointment is usually quite quick. But actually, if you've got any concerns before that time, just ring your local team. We do what we call a discharge call, which is a couple of days after the families have gone home. We do a bit of a sense check just to make sure that everything's okay. If the babies that they're feeding, if they're older children that they're moving, that their wound's okay, and that they've got their follow-up appointment as well. And then there's obviously lots of support for families out there. The accommodation that you'll stay in is usually charity driven. We've got interpreters that are free of charge. We can do it in person or we can do via video as well. We've got psychological support. We've got social work teams that can help with emotional and practical needs. And the nurse specialists are always there for support as well. We've obviously got external support like tiny tickers for any information resource that you'd like to look at on their website. And as I say, we use the BHF as well for their preparing your children for surgery. So in summary, it's a big thing, but you're not alone. There's lots of resource, there's lots of people out there that can help. Don't sit at home worrying or wondering and pick up the phone and ask your question. There's no silly questions at all. And our team and your team at your local hospital is there every step of the way for you. So please use us. Thanks very much.
Thank you so much, Helen. That was absolutely fantastic. Such a comprehensive overview. I'm sure people will have some thoughts or some comments or some questions that can pop in the chat or in the Q&A box as well. But I really appreciate that. Thank you. I think there were a couple of things that sort of really struck me as someone who has been through this experience, albeit a number of years ago now, because my daughter, who's now 18 years old, had surgery when she was a little baby. But the comments you made about looking after yourself as well, it is tempting as a parent to try to stay up all night, to be at the bedside every second, but quite quickly in a hospital you find you're eating rubbish, you're not sleeping well, and you're in no fit state to look after your baby, let alone you can't if you're not able to look after yourself. So taking those breaks and looking after yourself is important, and I think that comes down to sort of relying on the experience of the nursing team as well. That was another thing that struck me as you mentioned it. I was just thinking back to our own experience, and particularly on the day of surgery, it was the nurse who was assigned to us as the parents who helped us get through that day. And for the parent, of course, it's such a unique experience going through this, but for for you as nurses, this is your day job, isn't it? And you've got all that wealth of experience that we as families can tap into. So that's another
Yeah.
message I would say, is sort of really be guided by your cardiac team, because they really do know what they're doing.
Thank you.
You just mentioned briefly on the consents there as well. That was something that I found as one of the harder points of the journey. Actually, that was something that sort of I remember now when you mentioned it, thinking back, that meeting with the surgeon and with the anaesthetist to actually go through the detail of the surgery was quite a tough thing to do as a parent. So I just thought I'd mention that, just to be sort of aware of that. And again, there was a nurse in the room who then was able to speak to us after the meeting and sort of through that as well. But yeah, there's various challenges along the way, and it was brilliant to be able to go through those step by step and to get your view on them. So thank you very much.
No
Right,
problem.
so we're going to hand over to Rachel next, who's going to talk about this from a psychological point of view. So Rachel, over to you.
Thanks, John. And thanks, Helen. There's lots of wonderful bits, and I was imagining everybody kind of scribbling things down. But yeah, it's the whole team around your child, so it's using them. My role at Leeds is I work as a clinical psychologist with children and adults going through heart surgery, and the biggest part of my day-to-day job is preparing or helping with preparation. And we know that preparation is vital, so it's not a nice to have, it's essential and it's vital. And so my talk now is just a little bit about what will help with preparing your child. John mentioned it at the start of the call, and I'm just going to echo what he said, but it's that yeah, just kind of looking after yourself in this. I mean, I think firstly, it's amazing that you've come today, because it's showing how proactive you are and how much you want to help your child. It's also thinking about yourself and looking after yourself in that. And I think it's really, really difficult to be told that your child has a heart condition, but it can be even harder to be told we're going to do heart surgery. And I'm assuming for a lot of people on this call today, the apprehension, anxiety, and stress is really quite high. So hopefully I'll help with some support around that. But yeah, you're in a difficult part. The apprehension and build up is understandably really, really difficult and challenging. So yeah, for many of you, you'll know about that. For others, your child might have been through surgery many times before, but what makes that hard, even though you've got that experience, is sometimes you've got memories of times when it's happened very urgently or it hasn't been planned or considered. And we hold on to those memories and assume that the next admission will be very similar. But I think with elective surgery, there's the beauty of time to plan and to prepare and to give you a sense of control, which we know can help reduce your feelings of overwhelm. So yeah, so stress, I've written stress, dread, fear, all very normal emotions, and completely expected. I think when it comes to young children and toddlers, what we have to hold on to is that our thoughts and feelings aren't their thoughts and feelings. So sometimes as adults, we are given the weight of information, like Helen was saying, consent forms, risk, meeting with the surgeon, hearing the plans, maybe even hearing the ins and outs. And what we do is we do try and protect children so that they only need to know what they need to know. And again, Helen echoed that in her presentation. So we must hold on to, as overwhelmed as we can sometimes feel and shocked by the news and thinking, how are we ever going to get through this? It's knowing for your child or toddler or older child, they are usually very in the moment. So that's normal cognitively for them to just be in the moment. And that means that they maybe don't have these huge overwhelming feelings about surgery that we do. But if they do or they don't, either way, preparation is absolutely key. And hold on to better prepared, more in control, and less overwhelmed for you and for your child. So a bit of a geeky bit here, but psychological research consistently shows that the importance of preparation. And I wanted to mention that again to echo that it's not a nice to have, this is essential. And we know that the more we prepare children for coming into hospital, the better they cope, the better the outcomes. We have found that the lower their pain can be, or experiences of pain and discomfort, the better emotionally they adjust. So Helen mentioned about the physiotherapist coming on day one and getting children up and out of bed. But if they're expecting that and they know about having a physiotherapist, they can, they can engage with that. So yeah, the psychological research consistently shows that there's preparation is absolutely is key, and there's better outcomes for everybody in that family. So for some of you on the call today, your children will already know that they're having surgery, and they might have known months in advance. They've met with the surgeon or they've met with the cardiac nurse specialist, and it's been discussed and talked about in some detail. For others, they may not be aware at all, and that's okay and that's understandable. Sometimes we ask children to leave the room, or sometimes we don't take children to the appointment with the surgeon. I think the thing to hold on to is you know your child better than anyone. So when is the right time to tell your child about their surgery or to talk to your child about their surgery? Think about being led by them. So think about your child's age, their cognitive ability, their level of general understanding, their emotional maturity, and meet them at the level that they're at. But that said, there is a bit of a rule of thumb that the longer children know about surgery, the kind of worse it can be for them in terms of build up and apprehension and anxiety. So we would say within 4 to 6 weeks, toddlers and above, it's the right time to start telling them or putting on their radar coming into hospital for surgery. So yeah, don't create unnecessary build up and apprehension. But that said, and I think Helen mentioned it as well, we struggle as a team to then help prepare children when they've maybe been told the weekend before and then they've come in on the Friday. So yeah, 4 to 6 weeks is a bit of a rule of thumb to be gently planting the seed of talking about having an operation, thinking about it, playing it through. What can we say? How do we start those conversations? Well, if children might already have loads and loads of questions about it already, and that's absolutely fine. But if the consultation was some time ago and you need to kind of put it back on the radar, set aside a bit of time when your child might be calm, not distracted, they're not busy doing other things, to have a talk to them about coming into hospital for an operation. Again, you know your child better than anybody, so use age appropriate language to explain that they need to have an operation to help their heart work better. And there's ways we can reframe this as well to make it less scary and less frightening. So the big in is that, hopefully you'll be able to play for longer. You'll be able to do a bit more running. You'll be able to join in these activities at school. We're always careful saying feel better, you'll feel better. We know the majority of children do feel better and do feel different after their heart surgery. But sometimes children might think, well, I've had my surgery and I don't feel any better because I'm uncomfortable and it's hurting to raise my arms and things like that. So stick with you will feel better, you'll be able to run around, you'll be able to do more things with your friends rather than that instant you'll feel better. And do encourage their questions. I think children have huge questions, don't they? You'll all have probably, for the children who are verbal, experiences of them asking these really big questions, and they can throw you, can't they? You're in the car to school and you hear from the back this big question about life, and it really can floor you. We would always say things are on a need to know basis. So tell your child honestly. You don't need to lie to them, but you can be brief and you can kind of be careful with how you reframe that information. So an example would be, will it hurt having heart surgery? We have to answer honestly and say it can hurt. For some children, it can hurt. There is something that the medical team around you can do to look after you and make that pain go away. So there's always a sort of a nice counterbalance to that big question. Another example is how will the surgeon get to my heart? And again, we don't need to know about they don't need to know about the sternum or going in through the skin unless they ask. But it's about saying you'll have a special medication, and this means you won't be able to feel anything, and you will be asleep for your operation. It's really, really useful to help children prepare in terms of what they'll see or feel. So some good examples that you can start doing now is looking at the hospital. All hospitals have websites. Usually the cardiology centres have pictures of the ward, images of the entrance. Children have probably been to the hospital lots of times before. So bring those back to the fore about the images of the hospital. Ask your cardiac nurse specialist if you can have a visit. Again, it can just be a really low-key visit. Come, after school, have a little look round, play in the playroom for a bit and come away. The only caveat to that is times maybe where there are infections or things in the hospital, but always do ask the cardiac nurse specialist if you can have a tour of the ward. And we might remember the ward, but it can be really helpful for children to look. And what that does is it brings up more questions for them, which we can answer, like I say, briefly, but honestly. Hospitals have equipment and information that you can take away. So I know children I've worked with have found it really helpful to see what the plaster looks like, the kind of waffle plaster that goes over the site of their their wound, to stick it on themselves, stick it on Teddy, stick it on Mummy and Daddy, to have a cannula tube, which in Leeds we say it's like a cat's whisker, as thin as a cat's whisker, but to have a little play with that, to stick it with tape on the outside of their hand, to take rubber gloves home, to have the feel of what those rubber gloves will feel like. But anything that can replicate what they might see and feel in hospital is really, really helpful. What we know about children is when they don't have enough information about what's going to happen, they tend to fill the gaps. We do that as adults as well, but then sometimes they can assume the worst. So that's why we say answer those questions honestly but briefly. Conversely, sometimes children have magical thinking. So they think, and we sometimes collude with that, don't we? Well, you'll be asleep and then you'll wake up and you'll feel amazing. And again, it's trying to stick to honest responses. And children won't, after surgery, feel instantly better. You know, it's normal and realistic for them to feel sore, uncomfortable, a bit groggy, a bit sleepy. So we never say to them that something won't hurt, and we just don't know. That we all have different pain thresholds, and what some children, Helen was saying, babies just seem to kind of fly through surgery, but for older children, sometimes the anxiety about what's happened to them means, like she was saying about that boy with the shoulders, but they hold themselves tighter. They do feel that pain a bit more acutely. So we never kind of offer instant reassurance, and that's what's really hard as a parent. You want to wrap them up, take this all away, make it all okay for them. And this advice is kind of saying, you know, be realistic, be honest, and where possible, factual. But again, it's on a need to know basis. Talk to your child, sorry, about surgery being part of an ongoing conversation. So I was saying at the start to kind of sit them down when they're calm and have a look at books and images and the website pictures. But it's an ongoing process, so don't think of it as a one-off. I've done that, I've prepared them for surgery. It's okay to just cheer up in, ask your child. You might see signs that they're thinking about surgery, or they might be asking lots and lots of questions. Those are usually signs that children are quite unsettled. But if they don't, and it's just not on their radar, they're happy playing, they're happy in school or preschool, it's okay to check in and say, is there anything you want to know about your operation? Do you want to play? Should we play hospitals? Just to kind of keep that line of communication open for your child, and to stop them filling in the gaps, but to stop them having that magical thinking of, you know, magic wand being waved over them or something like that. Involvement, getting your child involved is key, and Helen's mentioned it as well, but go shopping with them, buy button down pajamas, let them choose the bag that they want to take, the blanket they want to take. This is all part of giving your child some control back, and there is little pockets of control they can have when they're in hospital. You know, would you like this plaster or this plaster? Would you like to choose a cannula with a pink tube or a blue tube? There's lots of different things they can have, but the more you can give back some control and ownership to your child, the better. And packing is the really kind of key part that you can do. And again, it opens up those opportunities for conversation. Why am I taking a wash bag? Are you taking a wash bag because you'll be sleeping over at the hospital? You need your toothbrush, things like that. So yep, shopping. Children love usually a shopping trip or picking things out that they like the look of. Get them to put their toys and teddies in that they find comforting. Helen mentioned games, toys, activities. Try and have some new things. Again, it can be charity shop finds or little bits that from home that they really like, but something that they can pull out and that will engage them and keep them as distracted as possible. Particularly around times of fasting when they're waiting for surgery, might start to be getting a bit irritable. And it's always really nice to plan a special treat for after hospital. You can write it on the calendar together. If it's a trip, you know, to a farm or to, you know, the ice cream shop round the corner, get a picture of it, talk about it, mention it when you're passing. That's where we're going to go when you've had your operation. Kind of keep those things in mind, because your child really does deserve that treat, but you deserve that nice time with them. So plan something really nice together to look forward to. And it also helps your child know that there is an end to this. You'll go into hospital, you will have your operation, and then there's nice things to look at out and look forward to when you come home. So managing children's feelings of worry. So what should we look out for? So worry can manifest in children in lots of different ways. So for toddlers and preschool children, and primary school age children, they may not have the words or the emotional literacy to describe what they're feeling, and that's entirely understandable and normal. And we wouldn't expect too much of them. But you might see their feelings of worry come through their behaviours. So they might talk about physical sensations. So you might hear them saying, "I've got a tummy ache." my chest hurts. And that can be a bit triggering actually, because we're thinking, oh, they're deteriorating, or there's a problem, or there's something wrong with their heart. But again, you know your child really, really well. Is it normal for them to have tightness in their chest first thing in the morning or on a school morning? Or is that a bit out of the ordinary? If it's out of the ordinary and it's not something you're concerned about, it tends to be that they're feeling that normal feeling of anxiety, which we feel usually in our chest, our tummy, and our head. So look out and listen out for those kind of signs of I'm not feeling very well, and not to try and jump too much into being a problem. Um, Regressions are really key in children coming in for heart surgery, and we take a lot of calls from families, and we're often kind of saying go with the regression. So regression is when a child goes backwards in a developmental stage. So it might be that you've got a child who's 3.5 and hasn't had a dummy for a year, but then they're asking for a dummy again. Might be a child that wants a bottle. It might be your 10-year-old saying, "Can you carry me?" And what we say, these are all signs of care-seeking behaviour. They're feeling unsettled and are wanting to elicit care from you, and a closeness and a connection. So we say go with it. You might feel awkward or a bit uncomfortable about getting the dummy back out. It won't last forever. It's a child's way of going, I don't feel very safe, actually. I feel a bit uneasy. And what they tend to do is drop those things as soon as they feel better. So go with the regression. Nappies, we sometimes see children kind of wetting the bed again. And it's usually regression is a sign of feeling a bit unsafe, a bit insecure, and needing that closeness and connection through, a care-seeking behaviour. Children can be more clingy, and wanting more cuddles and closeness. That's absolutely understandable and normal. But we can also see angry outbursts, irritability. When children kind of pudding round, they're on the sofa and then they're on here, and again, it's that body feeling tension and stress, but not having the words to verbalise. I'm really scared about my operation. So kind of look out for those. You might also see a child being quieter and a bit more subdued, not wanting to play as much. And I guess my top tip about helping children when you see any of these signs of anxiety is remain curious. Now, I'm just wondering, are you feeling a bit unsettled about something? Is there something you'd like to talk about? Do you want to come for a cuddle? Should we have a bit of time together? Um, is something bothering you? And open those questions out to your child, and ask and keep asking. They might say they're fine, and that's okay. And that's an end to that conversation. But just keep checking in and being curious. It doesn't always mean children do all sorts of sometimes unusual behaviors, and it doesn't always mean that it's a sign of anxiety. But there are some key things to be looking out for. And go with those regressions, go with the clinginess. They want to be held in the 10 rather than you're too big for that. Go, come on, let's have a cuddle, because it's that I need to be close to somebody. Survival mechanism. I say all feelings are acceptable as well. When children are angry, and fed up and don't want to go to hospital for surgery, or they feel fed up that they've got a heart condition and they're sort of saying, asking big questions, well, why have I got this? That can be really, really hard to listen to, and it can kind of stop us in our tracks as to what to say. It's allowing these feelings to come. So it is completely understandable and natural to have a full range of emotions in the build up to something like heart surgery. Be curious, ask them what's on their mind, and if they can't articulate it, would they like to draw it? Would they like to get the pens out? Would they like to squish some clay? Would they like to punch a pillow? But keep offering closeness, connection, and comfort, because that can help calm their nervous system. So when they're feeling that irritability and tension, do some slow breathing with them, hold them close, and calm them as much as you can. I guess a key message for me is to be able to care for other people. We need to have some care ourselves. You've probably heard the saying many times over, and I'm sorry to repeat it, but you can't pour from an empty cup. And this feels very true for parents who are caring for their children and family, whilst also feeling really worried about forthcoming heart surgery. We are all different, and some people like to keep very busy and distracted to kind of manage that build up and tension. Other people do feel a bit more emotional and want to share their worries and fears and say that they're scared, and cry about that. We know, again, research always tells us that having comfort from other people can help contain us emotionally. So if you can find somebody in your network to talk to about how you're feeling, that helps share the emotional burden. I think what we see within the psychology service at Leeds is family members often protect other family members, so hold on to feelings of worry and don't share them. But all that does is it creates quite a lot of build up and tension in your bodies. So if you can find somebody in your network to talk to, that's brilliant. We appreciate not everybody has somebody. Tiny Tickers are fantastic at putting on peer support sessions for parents. And there are two groups that run every month, and they're online groups for under ones and children, children under two and children over two. I do the children's over two group on a Tuesday, the last Tuesday of every month. And the purpose of that is a safe space to come and talk about any worries that are on your mind and have that link with other parents who have been through very, very similar journeys themselves and can listen and offer kind of non-judgmental support and guidance. So there is always somebody you can talk to. We'd also recommend speaking to the hospital. Every hospital up and down the country, it's part of the NHS plan, has, cardiac nurse specialists who are there to listen, psychologists within the service who are there to listen, play specialists who are there to do the play preparation if you're feeling overwhelmed and can't do that with them. So bear in mind, like we were saying at the start of this conversation, there are lots of people around your child, but there are also people around you, whether that's the hospital, whether that's Tiny Tickers, whether it's friends and family, community. But if you can share in your feelings of sort of stress and worry, please do so. Yeah, thanks. That's just a message has just gone on about joining the group. So yeah, there's a link in the chat about that. I think knowledge is power. I would say that. So the more you know about what will happen before, during, and after the surgery, the better. So equip yourself with the emotional support, but also the knowledge and the information. I think avoidance is key. We all avoid, and it's a normal human behavior and trait when we feel overwhelmed and scared about something. But actually, if we avoid asking the questions ourselves or making plans or linking in with the hospital about what's going to happen, we kind of shy away from that, we're then not prepared, so we can't communicate that with our children. So that, yeah, please do link in with your hospital and ask as many questions. There is no stupid question. We ask questions because we're worried, and yeah, write these down. And when you get to speak to the cardiac nurse specialist before coming in for surgery, please do, yeah, ask any questions. And if you struggle to talk to your child, please let the hospital know. And we've worked with families where they are just so frightened, and it's understandable. It's natural. You don't have to beat yourself up. It's a big deal. So we as hospital members of staff can help support your child with preparation. At Leeds, we've got a clinic, a preparation for surgery clinic. So children come, meet our play specialist, meet us in the psychology team, do lots of play and talking and drawing, and we hope that they leave feeling better prepared. But we appreciate not every hospital has that, so it's worth finding out what's available in the hospital and who in the professional team around your child can talk to them. So it doesn't all have to be on your shoulders. You don't have to be a whiz bang play specialist or psychologist. But that said, you do know your child, and be led by them. Some children love it, love getting out the stethoscope, love getting out the plasters and stickers and ECG things to play with. Others, they're just not bothered, and that's okay. Be led by your child. I'll just check the clock. Okay, I'll just end on this. But Helen mentioned it. I think it's really, really important to raise it that unfortunately sometimes surgery is cancelled due to an urgent admission. And this understandably can leave you feeling very frustrated, cross. Some people do actually lose trust in the hospital when they've spent so long preparing their child, and then they've come in and they're all ready and they've got everything lined up, and then it doesn't happen last minute. It is a really, really difficult situation, and one nobody wants. What we say in these situations is, for your child particularly, I mean, we as adults can have really big feelings about this, and children can sometimes pick up those feelings. But what we would do for children who have come into hospital awaiting their surgery is to treat it like a preparation. Well done you. You've come in, you've laid on the bed, you've unpacked your bag. You'll see where we're going to come next time, and try and praise every step that they've done as practice and almost like a dress rehearsal of coming into hospital next time. It is really hard to contain your own feelings about it and the frustration, but for children, say, well done you for what you've done, praise every step that they have achieved. sometimes children get a real sense of mastery, and that can empower them to go, okay, I know what I'm doing next time, and I feel quite confident about it. Other children might feel quite disappointed and a bit let down. But you will always get a call from the hospital about the next step. So you will get a new surgery date, you will get booked back in. Your child hasn't lost their place at the top of the waiting list. So hold on to that. The hospital will work with you as hard as they can to get, the next available slot. So yeah, but think about the preparation that's gone on in those scenarios. And again, use the people around you to talk. So family, friends, community, tiny tickers, or the hospital team. I'm just really mindful of time, and I think you said it rightly, John, at the start of this call. It's such a big topic, isn't it? We could talk so much about the different areas. But yeah, the take-home messages from me are preparation is key in whatever form that looks like. Talking, playing, drawing, visiting the hospital, long walk with the dog, and talking as you walk the dog, anything. But the more we avoid, the more our children don't feel prepared. So sometimes it's taking those deep breaths ourselves and having those conversations and opening up the big questions. But knowing you don't have to bluff. We will always help you as a team answer those difficult questions. And yeah, you're absolutely not on your own. And you've already taken the first step to getting support by coming today. So yeah, so thank you.
Yes, thank you so much.
Okay.
That was really, really useful as well. And I think that dovetails so nicely with everything that Helen was saying. My prediction of 45 minutes has clearly gone out the window. It's okay, 'cause I'm going to edit that out of the recorded version. So no one will be aiming for 45 minutes. I think it's such an important topic there, isn't it? That it's worth just giving it the space to talk these things through. I'm conscious that people might have to finish their lunch hour and get back to work. We will go through the Q&A. If you need to disappear, as we said, it's all been recorded, so you'll be able to jump back on when we send the video around and watch anything that you're going to miss out on now. But we'll just spend a few minutes just going through the few questions that we have had in. There's a couple that have come in the Q&A box, so I'll just go through those very quickly. First, there's one that says, my little boy is having surgery in London. How do we get the rooms, please? So presumably the parent accommodation. I guess that's a case of talking to the cardiac nursing team, Helen. That's probably one for you.
Yeah, definitely. It's usually the nurse specialist or the admin team who arrange the rooms for you, and that's often done without you even knowing. Unless someone tells us, that they specifically don't want a room, we will just request the room, and then we can always cancel it if plans change or whatever. But yeah, speak to the nurse specialist team or whoever your pre-op team is.
And most hospitals, in my experience, seem to either have rooms within the hospitals themselves, or as you mentioned, the Ronald McDonald houses.
Yeah.
Shout out to the other fabulous charity, Sick Children's Trust, that do
Yeah.
hospital accommodation as well. So most units I'm aware of will have something available, hopefully. Thank you.
Yeah, and sorry, just to mention as well, on the cardiac wards, generally you can stay with your child as well as having a parent accommodation. So on our ward specifically, I mentioned intensive care before, you can't sleep on the ward, but on the cardiac ward, there is space for one parent to stay by the child's bed. And then the other parent or carer or brother or sister can be in the parent accommodation.
Yes, I've done that myself, sleeping on camp beds next
Yeah.
to the cots and beds. Yeah, I've been there. So yeah, that's an option as well, isn't it? The other question in the Q&A is that this person's son has pulmonary atresia, and is due first open heart surgery around 1 year old to conduct the first stage of the unifocalization. And the question is that whilst every child's different, generally how long between surgeries do you wait for the second surgery?
It's very, very variable. So yeah, each child, every child, as I said before, you could have, 5 children all having pulmonary atresia, but they'll all be slightly different. So that's why you're followed up in between operations, for the cardiologist to keep you updated, about where we're up to, what the next plan is. So very difficult to say on an individual basis.
Yeah, thanks very much. And then we had a couple of questions that came in on our Facebook group before, people who weren't able to attend live but wanted to ask questions. The first one was, what can I do on a day of surgery to help me pass the time? I mean, that's a great question, isn't it? I don't know if you want to come in on first on that one, Helen.
Yeah, it's going to be the longest day of your life, generally, isn't it? And also we ask you to stay on the hospital grounds or within the hospital grounds, so even more restricted to sort of what you can do and where you can go. I'd maybe get if you've got a couple of family members or a couple of friends to pop in and schedule them through the day and go for a coffee with them, just to break the day up. Download a couple of series, a couple of films off Netflix or Disney Plus or wherever, just to sit and just put yourself in a different in a different place. Just take your mind off it a bit and get something to eat as well, because you're going to need to be there for your child later. So as you said before, look after yourself as well. Don't know if Rachel's got any other advice around that.
Yeah. Yeah, I think panic can sometimes set in. It's really common, isn't it? Our brains will take us to sometimes worst case scenarios, and with that comes a lot of adrenaline. The adrenaline in your system can make your own heart feel like it's pounding, and you might feel dry in your mouth or tense in your arms and shoulders. And that physiologically is a really horrible feeling for a lot of parents to sustain for, like you saying, Helen, a long, 5, 6, 7, 8 hours.
Mm.
So think about your nervous system and think about trying to slow down your own breathing to give you moments of calm. It won't be normal for you to feel super calm. It's such a big deal. But anything you can do to give you a moment of calm. So yeah, some deep, slow breathing, calm your nervous system, some fresh air. Fresh air can just almost reset you a little bit. So stay in the hospital grounds, but walk around the peripheries or find a garden in the hospital area just to sit quietly. But yeah, hydration, so essential. And if you can't stomach eating because your nervous system is shot and you're so churned up, just snack through the day, and one for the hospital bag maybe, but drinks, sugary drinks, anything that can pick up your energy levels a little bit.
Yeah, I can cast my mind back to my own experience there. So our daughter went down for surgery quite early in the morning. So before surgery, we were able to give her a bath, and then we took her down to the theatre, said goodbye to her in the theatre, which is probably the hardest bit of the entire experience, to be honest. But then that's when the nursing team then took us to the PICU to show us the machines that she'd be on, so we would be prepared for where we were meant to come later in the day. And then we took the nurse's advice, and we were saying this earlier, that they know what's best, and they said, right, get yourself out of the hospital, get some fresh air, go for a coffee. So we did that. We wasted some time doing that. We were allowed to leave the hospital grounds, so we actually just did a little bit of shopping. We bought a necklace that's a good luck charm for my wife. I remember that. And then we wasted the afternoon. And I can vividly remember, and this shows you what a stressful day it is, that sort of best part of 19 years later, I can remember this. We watched 60-Minute Makeover on ITV. It's like in the parents' accommodation, just killing time, because so long ago we didn't have all the distractions of being able to download Netflix series. So we just had to put up with whatever was on telly at the time. But I don't think it's a right or wrong thing to do that day, is that you just got to get through it the best you can. As you said, Helen, it's the longest day of your life. So I really like the idea of downloading some stuff in advance and getting prepared. And I really like the idea of having some friends come and just spend some time with you, and maybe sort of like a shuttle run of friends 2 or 3 times across the day if you know your child's going to be in surgery for a long time. That could be really useful. One other thing that just sort of resonated with me then is you can also use friends to update everyone else as well. And that's quite a useful tip that we've had parents come to us with at Tiny Tickers, that everyone wants to know how things are going. And if you're juggling trying to keep everyone updated as well, that can be an extra burden on you. So quite a lot of families will ask one of their closest friends or a relative, right, can you be the contact point? We'll tell you what's going on. Can you then farm that out through social media or to this network, just to take a little bit of pressure off yourself? That's another little tip there. And then the other question was around siblings and how to prepare siblings for the fact that their younger brother or sister might be having surgery. And I guess, Rachel, a lot of the things that you were saying about preparing the child themselves would be just as relevant to preparing a sibling, their baby brother or sister.
Absolutely. Yeah, involve them. It's really lovely to involve them, and they can be curious as well. They can bring questions. It gives opportunities to play. Siblings are brilliant at kind of being patients themselves. So let your child that's going through the operation do play with their sibling, but yeah, let them be involved. It doesn't have to be something that's secretive or private. Talk about it. It's on the calendar. 3 more days. Keep it in your communication as a family. That your sibling might want to pack a bag, help pack the bag. They might want to put in things like pictures that they've drawn, something that's special to them that they want to give their sibling. But again, encourage them linking, joining in and linking in with what you're doing with your child.
Fabulous. And we were talking about the Tiny Tickers resources. I've got a few to hand here. So this is our siblings book that we actually wrote in conjunction with the nursing team at Alder Hey. And so that's got some advice and some information for siblings. And then the other booklet that we've got, that many of you might have already got, is this Things We'd Like to Tell You About CHD booklet aimed at parents. It's got loads of peer advice in it, but it's also got sections where you can see the different machines you might be coming across. A lot of the content that Helen, you talked about all the different health professionals you're going to come across. Loads of peer advice and tips about surgery day, about advance and about afterwards as well. Those materials are part of our family support packs. You can get those for free. You can jump on our website, and Vicky in the chat would have put some links in how you can have these. So if you haven't already, please do order those from us. We'll also be, I think that's all the questions actually, so I'll wrap up now. We'll also be sending out some handouts after this, so a lot of the tips and advice that Helen and Rachel gave will be put in a document for you, so you can have those, and all the signposting to the links that Vicky's kindly put in the chat for our peer groups, for our information materials. All of those will come in the handout as well as that video that I just mentioned before, where we will get some of the team just talking about their experiences as well. I'm just going to pop a really quick feedback poll up. If anyone's able to just answer that would be fantastic. Hopefully you can see a poll that's come up on your screen now. Just a couple of really quick questions that we can go back to our funders with, if that's come up. If not, we'll put a link to it in the information we send you afterwards. I think that's it now. We've run massively over time, but I think it was so an important topic to explore in detail. And we were saying before we started, we could have done an entire series. So I'm sure it's something that we'll come back to in future webinars. Please do follow us on social media, and you'll find out loads more support and information materials. Sign up to our newsletters, join our Facebook groups, and all of that sort of thing. I want to say a huge thank you to Rachel and Helen for your time and effort and preparation, and then delivering that topic today. I think it's been so useful, and I'm sure everyone who's on the call will think that, and everyone who's watching the video afterwards will think it as well. And lastly, I'll just say good luck to everyone who is watching this, because they're preparing for their child's surgery. All the very best for that, for the surgery and for the recovery period afterwards. All of us at Tiny Tickers will be thinking of you. If there's anything we can do to support and help you through that process at all, please do get in touch. But all the very best. And in the meantime, thank you again, Rachel, Helen, and we will see you at the next webinar in the series, hopefully. So thank you for your time today. Have a brilliant rest of the day. Goodbye, everyone.
Yeah, bye-bye.
Bye.